Want to 10x your growth? Discover how only 3 growth hacks in 10 days can change everything. Welcome to the 10-Day Growth Hacking Challenge with your host, Nader Sabri. Today, we are here looking at how there's going to be some disruption in a very tight area in the healthcare space. Before we get started and introduce our next contenders, I just want to remind you that this is based on the growth thinking methodology, which is how we do things in the challenge. If you want to do what we're doing here, this is how you do it. Welcome aboard, guys. Today, we're here with Klaim. We've got Ahmed, we've got Vlad, and we've got Mona Lisa, and we've got obviously a much larger team beyond this who are not here with us today. Guys, welcome aboard and congratulations for being nominated to the challenge. Are you guys ready to get started?
Absolutely.
Yes, we are.
Thank you.
All right, that's the energy, man. That's the energy. So as we kick in, guys, healthcare space, as we know, is a very sensitive area. I think health in many cases was taken for granted prior to the pandemic in many levels. And that has dramatically changed in the last couple of years, especially in the last few months that relate to the healthcare sector. This has introduced new types of challenges that need to be disrupted. And ultimately, as we've seen in other challengers, that the deeper you're solving a problem, the more value you're adding. At the end, we're all problem solvers, and that's why our companies exist, and that's why we're here today. Klaim solves a very interesting problem that may not necessarily be visible to the patient, but is an ability for hospitals to be paid, and I'm going to let the team explain it better, of course, than I can, who are more eloquent at this, ensuring that payment works between all the parties involved so that the patient can receive the healthcare that they require. On that note, I'll leave the floor to you guys. If you can give us a bit of background about Klaim, what Klaim does, and there we go. We're gonna go for it.
Ahmed, you want to take it?
Yep. Thank you very much, Nadir. Appreciate it. Yeah. So basically, Klaim is a fintech, medtech company, I would call it. We help a lot of healthcare providers, whether it's hospitals, clinics, pharmacies, laboratory, with their healthcare revenue cycle management payment solution. So what we do is we basically help the providers to expedite the payments and make sure that we can get their payments available to them within 7 working days. Where in normal ways, what is happening right now is it's taking 90 to 60 to 90 days to for them to get the payment. So what we do is we actually help them speed up their payment by funding them actually by making the payments to them and waiting for the insurance companies to pay us. Now, the other part, what we do is we provide healthcare analytics, which is making sure to give them an extra view of their claims and letting them know the health of their facility, their hospitals, and their clinics, and their laboratories or pharmacies.
Excellent. So the technical term is revenue cycle management, which is ensuring that payment works across the board, people on time, and tracking it. I've had the chance of taking a look a bit deeper at some of the data, and Klaim is a very data-rich company. And I think it's one of the golden cards, or one of the, let's call them superpowers. And I love working with data-rich companies because what can be done with data is almost infinite beyond what is actually offered as a dashboard. It can go so much deeper and can do so much more. And I think that's going to be one of the areas that we're going to be looking at, how to growth hack, because there's a lot of opportunity in that. Fantastic. Anything else you want to share with us before we move on? And I'm just going to let everyone know in the audience that information related to Klaim will be below. If you want to reach out to them or get to know them a little bit better, or if there's an opportunity or anything like that, you can go ahead and reach out to them. Information will be available below. Anything else you want to share about Klaim before we move forward onto your growth problems?
I think you said it really very right, that we are more of data-driven company than anything else. Definitely when it comes to healthcare, all our investment decision that we make is completely based on data-driven solution that we have.
Yeah, absolutely. And in today's age, I mean, data is oxygen. A business cannot breathe without data, let alone good data and frequently good quality data that can be used in absolutely unique ways. It's kind of funny because, entering the era we're in, people would say information is power, but I would say that information is no longer power, but rather the algorithm is where the power is today. It's how to use that information because data and information is so widely available. What to do with it is where the real problem is, and that is where the money is to be made in data-rich companies. On that note, guys, what are the 3 growth challenges that we are trying to tackle in these next 10 days? If you can articulate that into 3 points so our audience can understand, at least at a high level, what we're looking at.
Yeah, so I think we discussed it last time. We have on one side, healthcare providers that need cash, the oxygen to survive, right? And on the other side, we need to get this cash somewhere to give to the healthcare providers. And I think where we are stuck, there's a lot of demand, absolutely, for the services that we offer, a lot of demand for cash, as usual in any type of business. But in terms of the supply, how much cash we can actually, get and provide to those healthcare providers is limited, at least in the region where we are. So talking about growth hacks, I think the main topic of what we need to tackle immediately is we need to growth hack how to, get the money, which is the debt that we are going to be distributing to the healthcare providers. So starting from there, that's kind of the main topic. How can we get, an unlimited, let's call it an unlimited amount of money that we can distribute to the healthcare providers, from where we can obviously grow the business and make money as well. So this is the main topic. Going to the growth hacks, I would say what would be interesting to discover, number one, is the factoring marketplace, right? Where we can actually get investors, investors plugged into what we're already doing. That's number one. Number two, what we discussed last time is the ranking system that let's say report that we're going to distribute, the healthcare report that we're going to distribute and going to promote to the investors, again, to get the depth that we need. And the last one, I'm not sure, right? So I'm not sure what should be the last one, but that's the two growth hacks that I think we should work on, definitely.
Okay, great. So to recap the first one, so factoring, just in case those who are tuning in don't know what that means, factoring is essentially getting paid in advance for money that's owed. And that helps ease cash flow, which is the heart of this business, which is revenue cycle management. Am I right? Right? Revenue cycle management. Exactly. Especially in a very sensitive sector like healthcare. I genuinely believe that Klaim is onto something actually much bigger than you guys might actually see, to be honest with you, because I see that this revenue management problem, especially being extremely data rich in a space where data can help money move in a much more fluid way, is not just a problem that can be resolved in this country. I think it can expand way beyond that. So mastering that is going to be the key in building that superpower. And so the first growth hack is building a marketplace that can gain access to basically competitive factoring or access to money. Correct?
Yes.
Right.
That's correct.
And excellent. And hack number two is from the playbook that we've used actually with some other people, but in different contexts, was essentially is a ranking or benchmark, because again, a data rich company has so much data to work with. The question is how to use it, and ways to do that is actually to explain to investors in a data-rich way what the opportunities would be in the healthcare sector. Of course, in this challenge, we do 3 growth hacks. So I'm going to ask you that, is there something that you'd like to put on the table as a 3rd growth hack at the moment, as we can always change things up or pivot as we move through this process?
Is there anything else, Ahmed, you're thinking about?
No, I think for now, these are the 2 main challenges that we have to look at right now. Okay. And I believe the 3rd one is going to be the adoption of the market adoption, like changing the legacy behavior, I would say, in the healthcare space, which takes a lot of time for them to accept and get into a new change or new technology. I think that's got to be the 3rd one that I can think of.
Yeah, I think that's a really good one, because if you're a disruptive company and you're about to pivot, which I believe you will be, you will need to change behaviors. And that's not an easy thing to do, but with the right incentives and the proper growth hacks, you actually can do that. As long as the problem you're solving and the value attached to it, it's much greater than the effort required by the individual to change slight behaviors, not radical behaviors, but slight behaviors in a very smooth, easy way, you'll start to see incredible amount of traction in the short term that can build into momentum and result in very significant revenue for you in the long term. So I think we've outlined that in a basic way. I think as we go deeper into the growth hack, we will definitely deal with more of those details. Anything else you guys want to share related to these 3 growth hacks? If not, we can kickstart, and you get kickstart on growth hack number 1, and we'll talk in 3 days to see what those results look like.
Yeah, I think we can start digging down. Super excited.
Awesome. All right, guys. So that is the team at Klaim, who is shaking up an area classified as revenue cycle management to ensure the liquidity and movement of money in the hospital or healthcare system, to ensure that patients get the service they need, the facilities run at the levels they require, to further develop the healthcare implementation or the improvement of healthcare overall. They are in for a massive pivot. They're solving a really big problem that adds a lot of value. I see a lot of good things coming out of this. So keep tuned. We are going to be looking at hack number 1 in 3 days. For more information about Klaim, go below. For those tuning out, as we go out, the challenge is based on the growth thinking design methodology. If you want to do what we're doing here, this is where you go. Gentlemen, I'll see you in 3 days.